Good afternoon, and thank you so much for joining me today for our Medicare Minute for August 2025. This month, we will be covering Medigaps, the original Medicare sidekick. Hello, my name is Allison, and I am the BCDA SHIP and SMP Manager here for Baltimore County Department of Aging. We are located in the room 321 on the third floor of the Bicota Senior Center in Towson, Maryland. We are here to help you and support you in any way when it comes to your Medicare questions or needs. So please feel free to reach out to us. You can call us on the phone at 410-887-2059, or feel free to email us at medicareinformation@baltimorecounty.md.gov. So let's go ahead and get right into it. We're going to be talking about Medigaps today and what they all include. So let's start with the first question. What is a Medigap? Well, a Medigap is a health insurance policy that offers standardized benefits to work with Original Medicare. Medigaps are like the trusty sidekicks to Original Medicare, and they swoop in to fill those pesky gaps in the coverage. These health insurance sidekicks, also known as Medicare supplement insurances, are brought to you by private insurance companies when Original Medicare takes the first swing at the bill. Medigaps fly in and tackle the deductibles, coinsurance, and copayments. They're even brave enough to cover some costs that Medicare skips, although, like healthcare on your globe-trotting escapades. In Maryland, you can pick from 10 different Medigap superheroes to suit your needs. So what do they cover? So every Medigap policy flies in with these awesome wallet-friendly perks. So the first group of things are things that all Medigaps do cover, which is Part A hospitalizations, coinsurances. So they cover those days 61 to day 90, which right now the coinsurance, if you didn't have a Medigap, is $419 per day. They also cover the 60 lifetime reserves, which is currently $838 per day in 2025. So you wouldn't even need to worry about those because your Medigap is going to be covering them. It also gives you an extra 365 hospital days for you to have in your stockpile. Another thing that all Medigaps cover is your Part B coinsurance. All Medigaps lend a hand for the 20% coinsurance on Medicare-covered outpatient services like x-rays, DMEs, and doctor visits. They'll all chip in for Part B coinsurances and fully cover certain preventative services. Also, the first 3 pints of blood are covered by your Medigap, so that's really important to know. And your Part A hospice care coinsurance is covered by your Medigap, and they will cover the full cost of hospice coinsurance and copays for hospice-related drugs and respite care if you were able to purchase a plan after June 1st, 2010. Respite care is a great resource that allows your loved ones to get a break while you enjoy hospice amenities. Some Medigaps, but not all, do dish out additional coverage, such as Part A skilled nursing facility. Some pay for these coinsurances for the days that you're in there, and some do not. Also, Part A deductible. Some cover the Part A deductible, the cash you owe up front at the start of the hospital stay, which for 2025 is $1,676. It also covers the Part B charges, any excess charges that you may experience. If non-participating Medicare providers charge up to 50% extra, some Medigaps will swoop in and cover it, sparing you from the extra fees. Foreign travel, while Medicare doesn't cover international escapades, some Medigaps will cover that 80% of emergency care abroad during the first 2 months of your trip, and up to a lifetime cap of $50,000. So, bon voyage to our traveling friends. So who pays when it comes to a Medigap? What's the order? So Medigap, like I said, is a very trusty sidekick to Original Medicare, and it will swoop in to cover some of and all of the costs that Medicare leaves behind. So picture this: you have both Original Medicare and a Medigap, and you're off to the local clinic for chest x-rays. Medicare steps in first, shelling out that 80% of the approved amount, while Medigap heroically tackles part or all of the remaining 20% coinsurance. Without a Medigap, you would be stuck footing that bill yourself. Choosing between Original Medicare with Medigap and a Medicare Advantage plan is like deciding between a buffet and a set menu. With Original Medicare with a Medigap, you're like a VIP with all access pass, able to see any doctor or use any facility that rolls out the Medicare welcome mat. No questions asked, no need to jump through referral hoops to see specialists either. Plus, the out-of-pocket expenses you are often facing are going to be a lot less when you do this. Contrast that with the Medicare Advantage plan, where you've got to stick to the in-network gang or risk being stuck with a bill. Also, if you are traveling, you may find your coverage does not travel with you. You're also likely to pay the copay game, which could be a winner if you don't visit the doctor often. These plans might charm you with extra goodies like vision, hearing, and dental care that Original Medicare doesn't throw in. And while you might have to cough up monthly premium on top of your Part B premium, it's usually lighter on the wallet compared to a Medigap premiums. So these are the plans that are offered here in Maryland. There's 10 plans and they go A through N. Note plans C and F are only available if you become newly eligible for Medicare before January 2020. So if you became eligible after that, you are not able to use those plans. Plan F and G also offer a high deductible option. You may pay a deductible in 2024 before Medigap coverage starts. Plan K and L pay 100% of your Part A and B coinsurance after you spend a certain amount of out-of-pocket. The 2025 out-of-pocket maximum is $7,220 for Plan K and $3,610 for Plan L. 80% of emergency care costs are covered during the first 60 days of each trip. After an annual deductible of $250, up to a maximum lifetime benefit of $50,000. This chart does not apply to Massachusetts, Minnesota, and Wisconsin. Those states have their own Medigap standard systems, so if you're from those state locations, you might want to call your SHIP office. So what happened to Plan E, H, I, and J? Well, in 2010, they stopped being sold. And if you bought a Medigap between July 31st, 1992 and June 1st, 2010, you can keep it even if it's not being sold anymore. Your benefits are different from what's on the chart shown in the previous slide. Hunting for a Medigap policy is like searching for the snazziest outfit. Check out offerings from a flock of insurance companies, even if you've already got your eye on a particular policy type. Policies with the same letter are like twins, sharing the same benefits, but their price tags could be as far apart as the sun and the moon. For example, grabbing a policy A for a company 1 gives you the same goodies as grabbing policy A from company 2, but the costs might make your wallet dance to a whole new rhythm. When picking a Medigap plan, be sure to quiz the insurance folks about how they whip up your premium price. Here's a hint. These factors could add a little zing to your Medigap costs. Pro tip. Snag your Medigap policy during your open enrollment period or when you've got that golden guaranteed issue right. Why? Because it's like a magical shield. Your premium won't skyrocket due to your health status during these times. Keep an eye out on Medigap companies playing the age card when setting the premiums. In Maryland, companies have the right to use age to determine premiums. They might shuffle the deck like this: the no age rated, where everyone pays the same price no matter if they're young or old. As long as they have a beating heart, they're all paying the same. There's the issue age rated, where your premium is like a time capsule locked in at the age that you first snagged the policy. The younger you are when you jump in, the cheaper the ride. Heads up, inflation might still give you a nudge upwards, but you won't be because of your age. And then there's also attained age rated. Starts off with a nod to your age when you buy, but brace for it to climb as you collect birthdays. Looks cheap at first, but it might just sneakily become the priciest pick over the years. In the wild world of Medigaps, each state has its own quirks for snagging the perfect plan. In Maryland, your golden ticket is during open enrollment periods, or an OEP, which kicks off the month you turn the big 6-5 and sign on with a Medicare Part A and B plan. The 6-month magic window lets you pick any Medigap policy without the nasty goblin of medical underwriting for being turned away for pre-existing conditions. Maryland also throws a birthday bash with its birthday rule, offering an annual chance to switch up your Medigap around your big day. But remember, you can only do this with a program that is equal or less in value. If you're on Medicare before 65, due to disabilities or other reasons, your Medigap options are as rare as a unicorn and often pricier. But once you hit 65, cue the confetti. You'll get to have a special enrollment period that drives back into Medigap shopping. Miss the Medigap boat and you might find your costs soaring, choices shrinking, or the Medigap gate slammed shut based on your health status, as you will not have the guaranteed issue right, so don't snooze and lose. Got a new Medigap policy? You've got 30 days to give it a spin. If it doesn't tickle your fancy, cancel and get your cash back hassle-free. After that, you can still cancel whenever, but tread carefully. Depending on your location, snagging a new policy might be trickier or pricier due to health factors. Thinking of switching Medigap policies? You got that 30-day period to see if it works for you. But don't ditch your old policy just yet. You might not get it back. Your countdown kicks off the day you enroll in the new policy. Happy policy shopping. Head up. Under federal law, Medigap insurers might play the waiting game for 6 months before covering any old health hiccups you had before your new coverage clicked in. This so-called pre-existing condition waiting period can be avoided if you snag a policy with a guaranteed issue right. Now, if you buy your Medigap during the golden open enrollment period, you're in luck. Your waiting period can be trimmed down by how long you had previous creditable insurance. Most health plans count, so if you had 2 months of it before getting a Medigap, your wait shrinks to 4 months. Score 6 months of credible coverage, boom, Medigap covers your prior conditions right away. But don't dilly-dally. If there's a break of more than 63 days in your coverage, no dice in reducing that wait. Shopping around for a Medigap policy is key, especially if you want to dodge the waiting period. Some policies skip entirely, so keep your eyes peeled for those gems. How do you snag the perfect Medigap? Before diving into a Medigap pool, here's the game plan. First, it's time to make a decision. Are you going to be Team Medicare Advantage or Team Original Medicare with a side of Medigap? Weigh your options and find your perfect match. Compare your options and see which combo fits you like a glove. 2. Decide to go to a Medigap route and eligible, discover your golden ticket moment to grab a Medigap and barrel it. That would be the open enrollment time or maybe even the birthday roll. 3. Time to explore the 10 fabulous standardized policies. It's like picking your favorite ice cream flavor. 4. Get the scoop on how Medigap deals with pre-existing conditions. You might find some costs temporarily left out in the cold. 5. Understand the secret sauce behind Medigap premiums. Knowing how insurers price them helps you snag the best deal. 6. Arm yourself with a list of questions when Medigap shopping. It's like having a trusty map in the wild world of insurance. Keep it handy, ask for help when needed, and simplify your questions. We'll dive that right now. So what are the questions you need to be asking? When you're sparring with those insurance wizards, this is what you need to do. Number 1, am I jumping into this during my open enrollment or my birthday rule? If not, do I have the golden ticket or am I rolling the dice? Number 2, what's the most wallet impact for this Medigap policy? 3, is the premium based on my health quirks, gender antics, puffing habits, material advertising, or any other funky factors? 4, are the premiums no age rated, meaning everyone is in the circus plays the same age, or is there different ages? Will the company give me the cold shoulder because of health quirks? Or 6, does the policy hit me with a pre-existing condition waiting game? And if so, how long before this party starts? And do I have the trusted coverage credits to cut the wait? Other things to chew on? If you lack golden right to snag the Medigap, ask the insurance guru how much extra they'll make you cough up. If you're under 65, ensure the company rolls out the welcome mat for young whippersnappers like yourself. And keep tabs on who you're chatting with when you are talking with these insurance companies. It's always good to know. Do Medigaps work with MSPs and Medicaid? Well, generally speaking, it's no. No for someone to sell you a Medigap if you already cozied up with a Medicaid or if you're in an MSP program that covers the Medicare cost sharing. But if you snagged a Medigap before hitching a ride with a Medicare savings program or a Medicaid, you can keep that coverage in your back pocket. If you find yourself on the other side of the income fence for your Medicaid or your Medicare savings program, your Medigap premium might just slim down your monthly income by the amount to shell out for that premium. Plus, if you're juggling Medicare, Medicaid, and Medigap, your Medigap can step in and pay for services from providers who give Medicaid the cold shoulder. Remember, these perks only waltz in if you got your Medigap before you put on the Medicaid MSP hat. As always, you can be a fraud fighter with the 4 R's. So record your medical appointments, review your EOBs and MSNs, report suspected fraud, and remember to protect your Medicare card. Thank you for watching, and if you have any additional questions, please give us a call at Baltimore County Department of Aging SHIP Office, 410-887-2059. And if you would like to request the Medigap booklet, which tells you in detail more about Medigaps, you can call 410-468-2244. Thank you.